Thank you so very much for that introduction. I really appreciate it. And I appreciate the opportunity to speak to all of you today. So what I thought we would do is do some introductions and Noreen started tell you a little bit about what public interest communications is. And then I'm going to talk about two key concepts, understanding the identities and worldviews of the people you are trying to reach, and how to use facts and data effectively. I think this could be, these are two concepts that if you master the basics of these, you will go far in what you're doing. So as Noreen said, I am from Florida originally, and I went to the University of Florida. I worked for 10 years as a journalist, and then I went to Washington, D.C. because I wanted to do more advocacy, communications, public citizen works in a variety of issue spaces, including health. When I was there, did a lot on safe and effective medications and also healthcare policy. We worked on universal health care, worked to end surprise medical billing. And while I was there, I was also a public citizen within the community, and I co-founded a volunteer organization called Smoke Free DC when it was controversial to have smoke-free bars and restaurants. And we got a smoke-free workplace law passed in the District of Columbia after working on it for about 4.5 years. And I learned a lot from that experience about how to speak to different groups of people. Um, and then a few years ago, I heard about an opportunity to come here back to the University of Florida and teach, not only to build our public interest communications curriculum here, but also to try and make it more of an academic discipline nationwide, which is why I'm super excited to be talking to all of you today. All right, I'm wondering if you could, in the Q&A, just please are you faculty, student, researcher, administrator, practitioner? I'd love to know a little bit more. And then what do you think is the most difficult challenge facing those in public health today? Finding common ground. Yes. Okay, we will be talking about finding common ground today because public interest communications can help with that. Yes, conflicting information. Okay, all right. Material science, excellent. Excellent. Faculty and researcher. Oh, wonderful. Thank you. We've got a Gator alum here. That's excellent. All right. Health gets put on the back burner. Aha. Okay. Well, public interest communications can help with that. There are concepts that we incorporate about making people care about big issues. Trust. Yes. Okay. Connecting because, yes, definitely. All right. And combating misinformation. Okay, so what I will talk about will address and I think help with these issues that you are bringing up here. So what is public interest communications? When I define this, I always like to start with a story because storytelling is a very powerful way to get concepts across. In the early days of the pandemic, before the pandemic was a pandemic in mid-March, when it was starting to really circulate and spread around the world, there were indications that this drug, remdesivir, which Gilead had originally developed to treat Ebola, might be effective in treating this novel coronavirus. Well, if so, this would be a really big deal. Gilead went to the FDA and applied for orphan drug status for this drug. Orphan drug status, of course, is for drugs used to treat rare diseases, under 200,000 cases. And drug companies that get this status for a drug get 7-year monopoly on the drug, which means they can set whatever price they want. Obviously, coronavirus was not going to be a rare disease. At the time, it was under 200,000 cases, but Gilead was trying to get in right under the wire. And the FDA, even though it was clear coronavirus was going to be a pandemic, granted Gilead orphan drug status for remdesivir. Well, we at Public Citizen were quite alarmed, as were many other organizations, public health organizations, and we decided we wanted to do something about this because we didn't think it was right for one company to be able to set whatever price it wanted on a drug that might be able to save millions of lives and might be the only drug that could do that, especially given taxpayers had helped develop this drug and paid for the development of this drug. So what to do? Well, we could go to the FDA and say, we know that you just gave this status to remdesivir, but we want you to take it back. That didn't seem like a good path. So we decided to ask Gilead to give up the status. So what we did, we and 50 other groups put together a letter and sent a letter to Gilead saying, please do the right thing. Please renounce this orphan drug status that you have for remdesivir. But we didn't just send it to Gilead, we also sent it to hundreds of healthcare reporters around the country, especially those who had been starting to cover this novel coronavirus. Well, within hours, Gilead announced that it was going to ask the FDA to rescind the orphan drug status for remdesivir. So very successful effort, very fast, probably one of the fastest accomplishments that we've had that I've experienced. But what this illustrates is how public interest communications is strategic, right? So we identify who must act to make our goal happen, and then we figure out what they care about and how to reach them. So what did Gilead care about? Gilead cared about its reputation. And so when it started to get public backlash about what it had done, it quickly changed course. So what we're going to talk about is a lot about figuring out who must act and what they care about. So the more formal definition for you, public interest communications, it's an emerging academic discipline based in strategic communications. And I say it's emerging academic discipline because it is not really a discipline that has been widespread taught throughout the country. We're trying to change that. Now, granted, communications has been used for social change for thousands of years. The difference is now we have research and science. Now we have cognitive linguistics and social science and psychology, and we know more about how people respond, what motivates them to act, the kinds of emotions that motivate people to act, and a lot of psychology that helps inform our communications to make them more effective. We identify solutions and then we map out a plan to achieve those solutions. So in public interest communications, we create strategic communications plans and put those into action. This is very key. We don't just raise awareness in public interest communications. Because we are aiming for structural social change, we want to mobilize people to act. Usually it's for policy change or behavior change. Policy, and we certainly see a lot of both of those in public health campaigns, right? We see policy for, let's say, ending surprise medical billing or getting the orphan drug status rescinded, or behavior change, such as no texting while driving or getting teens to stop vaping. Providing information and facts is important. It's an important component, but facts alone and just educating people and raising awareness alone doesn't mobilize them to act. Yes, they need to know about something to care about it, but if you just raise awareness without giving anyone something to do about it, then you're missing an opportunity. So we're very focused on mobilizing people to act. And because of the emphasis on communicating around shared values, which we'll talk about in a bit, public interest communications can help bridge divides. And I think this is something that we really need in the times that we are in. All right, so I'm going to give you a 4-question guide to strategic communications planning. If you answer these 4 questions, then you will have mapped out the basics of a strategic communications plan. So the first question is, what do you want to be true that isn't true now? The answer to that is your goal. What are you trying to accomplish? The second question is, who must act to make it happen? The third is, what would they believe if they were taking action? And the fourth is, how do we connect with them? And I'm going to spend most of the time talking about those, the second and third questions. So when we're thinking about who you're trying to reach as public health experts, these are usually the buckets that we have, right? We have policymakers at the federal, state, and local level. We have state and local public health workers. You may be trying to reach people who have medical conditions or people who engage in harmful behaviors, and you're trying to encourage them to change those behaviors. You may be trying to reach news media as a way to reach the other people. You might be trying to reach federal regulators, or you might be reaching people on the corporate level, right? Hospitals, health insurers, drug companies. So we ask who are we trying to reach and what do they value? But even within each of those bubbles, we want to dig deeper because not all federal, state, and local policymakers have the same outlook about things, and not all local and state public health workers do, right? So we think about segmenting and really diving in deeply to who we're trying to reach. You've probably heard people talk about, well, we're trying to reach the general public. In strategic communications, there is no such thing as the general public. So please disabuse yourself of the notion of the general public, because trying to get your message to everyone is like getting your message to no one. It is like standing in the middle of Times Square, talking and telling your message to everybody who passes by. You might find that it resonates with some of the people who pass by, but a lot of the people are not going to pay any attention. What you're saying is not going to resonate with them because they have different outlooks, different worldviews, different beliefs. So when we're thinking about who must act to make it happen, we think about 2 big buckets: the core actors and then the people who influence the core actors. The core actors are the only people who can make the change. So if we're talking about a policy change, the only people who can make a policy change are the people who can actually vote on the policy, such as lawmakers. Or if you're talking about a corporation, the CEO, the board of directors. And then we look at the people who influence the core actors. Who do the core actors respect, and who do they listen to? And the reason we separate these and have these 2 big buckets is because we're going to ask them to do different things and craft different messages for them depending on what they care about. So here's an example. And this was an effort that Public Citizen worked on when I was there. We were trying to end surprise medical billing. Of course, these were the bills that people used to get if they went to an emergency room, for instance, and were treated by some doctors or nurses who were out of their network. Well, if you're in the emergency room, you probably don't have the presence of mind, or you might not even be able to say, excuse me, before you operate, before you save my life, are you on my insurance? And so people were getting these enormous bills, and it was a huge problem. So we were trying to get Congress to end surprise medical billing. Here's how we might think about, and here's how we did think about the different actors. We started strategically by focusing on the lawmakers who were on the committees of jurisdiction that would need to approve the legislation to go to the full floor in each chamber. We're going to ask them to do different things, right? So for the core lawmakers, we're going to ask them to end surprise medical bills. What do they care about and value? They want to get reelected. What will we say to them? We'll tell them surprise medical bills are bankrupting your constituents, and they will be so grateful if you help them. Now, for the constituents, we're going to ask them to do something different. We're going to say, please share your story with your representative or post it on social media. What do they care about? They want to be able to afford healthcare. They want to be healthy. What we'll say to them is to motivate them. We'll say, your voice matters, share your story, and urge them to end surprise medical billing so this never happens to you again or anybody else, right? So this is kind of how we think about how we message to different people. So that leads us to what would they believe if they were taking action? This is a really cool area of public interest communications because we get into cognitive linguistics and the science of storytelling, the science of emotions. There's a lot about how compelling storytelling is to making people care about big issues. And the science of emotions tells us what emotions are more likely to motivate people to act. It turns out that positive emotions are much more motivating than negative emotions, but a combination is extremely motivating. In other words, providing that sense of urgency, but also giving people hope that there is something that can be done. So I'm going to talk a little bit about social identity. So question for you, how do you identify? For instance, I identify as a member of the University of Florida community. I'm a faculty member. I feel like I'm a teacher. I'm a mentor. I also identify as a swimmer because I'm on a swim team. I identify as a gardener and a bird watcher, and also a sister and a partner and a cat mom, right? Those are my identities, and I have groups, right? My swimming group, the teaching community here. And I'm wondering if you want to put in the Q&A for a moment, just how you identify. So the thing about groups is that they really steer a lot of our decisions and a lot of our behaviors and our opinions. There's a lot of research around this, and there are references at the end of the slides, and I have a QR code where I'm putting the slides in for you. So this is research showing that our brains literally adjust our opinions to fit in with our group, which is really fascinating. And the researchers believe that it has something to do with avoiding conflict, right? We want to align with our group. We value what our group says. We trust our group. And we want to avoid conflict. But we also care deeply about what our group, what people in our group say. And this is a really motivating factor, especially when we look at the political landscape, right? We have the red team and the blue team, and a lot of people identify with the red team or the blue team and what that team, the positions that that team takes are positions that we tend to align with because in part it's from this group that we belong to, right? We also need to consider biases, right? We all have biases. And these are just a few of the biases that really affect our opinions about things and decisions. The affinity bias, where we gravitate towards people like us, and this ties into our social identities and our groups, the groups that we belong to. Confirmation bias, I'm sure you're all familiar with that, right? We gravitate towards information that reinforces what we already believe. We seek affirmation, not necessarily information. And social media, of course, aggravates that because we tend to, because of algorithms, see more of what we agree with because we're clicking on that and we get even more of it. There's something called anchor bias, where we might rely on the very first piece of information we receive, and that frames our issue, our views on the issue going forward. And then the bandwagon bias, which is we embrace information because it's popular. So with all of this going on, and there's a lot more that goes into how we make decisions and what we believe, because a lot of it is also based on emotion and not necessarily reason. How do we make progress as public health experts? How do we navigate through all these factors and make progress. So that goes to shared values. Values, of course, are deep and widely held beliefs about what is important. And we're talking about things like democracy or equality or freedom or fairness, health, protection, safety, life, happiness, justice. All of these are values that hopefully pretty much everyone shares, right? So when we're talking to people and when we're approaching them, rather than starting at the level of the policy, we want to start at this more basic level of values. What are the shared values that we have in common that we can agree on so we can find common ground and go from there, right? Powerful messages motivate people to act, and powerful messages are based in these shared values. So here's an example of all of this in play, right? This is this is from a campaign from West North Carolina Health Network. This was during the pandemic. And the effort was to try and get people to take the vaccine, wear masks, and engage in these other behaviors that could be protective. As you see, there's not one message for everybody. There is no general public. Here we have very specific groups of people that care about different things, right? So if we look at the top left, we have a woman who looks maybe like a suburban mom, and she's saying the freedom the vaccine has given me to interact with in public has been a tremendous relief. So what might she value? She values freedom, and that's a very powerful word. That's a very powerful value. But also she values connection, right? She wants to be able to go out and be with people. So that message is rooted in those values. And it's for that group of actors. It's for people who would relate to her, other suburban moms. If we look to the right, we have a message in Spanish. It says, all of my family is vaccinated, and this allows us to spend time together without worrying about infecting each other. This is a different kind of value. This is based on values of family and people who put family first, and it is designed for the Spanish-speaking community. If we move to the clockwise to the man, he's saying it's a choice that benefits everyone and a choice I'm happy to make. So what the values are here in this message are choice, freedom, independence, right? These are things that he values, and this is designed for people who share similar values to him. In the middle on the bottom, we have another message around family and protection, right? A mom who wants to protect her family. And then in the last one is if you've already been vaccinated for other things, getting the COVID vaccine isn't too different. This is designed for the community that was kind of scared of the vaccine and distrustful of experts and doctors who had failed them in the past. And this was designed to reach the community of people who had that fear and hear from someone who was one of them say, you know what, it's another vaccine and it's fine, right? Someone who values values safety and values being able to trust another person. So this campaign was quite successful. Here's some metrics from it. 51% said they sought more information. 30% said the ads actually affected their behavior, which is great. If we're going for behavior change, that's what we want to see. And then more visited the link to learn more and get more information. So that's an example of this in practice. So that's about actors and reaching them and thinking about what they believe. There's a lot more, and I do at the end give you some resources. I want to talk about facts and numbers and how to use those effectively. Because especially in the public health field and really any science field, we have all this data, all this information. And to us, it's so persuasive because, of course, we are on board. We have the biases. We know. And so when we see facts and numbers, they mean a lot to us, but they might not necessarily mean that much to the people that you're communicating with. So how can you use them effectively? So here's an example of something that is not effective. This is not effective for a variety of reasons. First of all, there are way too many numbers here. It's hard to really know what's important. And these are huge numbers, right? 74.1 billion, 1.4 trillion. Research shows that with really big numbers, people, they lose meaning for people because they really can't relate. So if you were to really boil this down and you really wanted to figure out and say, okay, what is the essence of what we're trying to convey here? You would want to start by, first of all, framing what you're about to show with the numbers. And in this case, the problem that is expounded on in this previous paragraph is that healthcare spending is costing us all a lot more than it used to, and it's out of control. That's a very, very basic summary. Then we introduce some numbers, right? And we want to say, well, in 1960, 1 in every $20 in the US economy was spent on healthcare, and today it's almost 1 out of every $5. So what we're doing here is we're pulling out some of the kind of the most salient and important numbers and statistics that will help illustrate the point we're trying to make. And then we end with a solution. Medicare for all would reduce costs. Again, this is super basic, super simple, but I'm just giving you the structure to show. So here's another example. This was a study of malpractice claims and looking at how many physicians were responsible for malpractice claims. Again, a ton of numbers here, right? A lot of good data. When the New York Times wrote about this study, this is what it looked like. And there's obviously a lot longer story, but there are very few numbers in the New York Times story. And if you see the red arrow, the numbers that the New York Times pulled out were the most salient ones, which was the finding that about 2% of doctors were responsible for about 39% of all medical malpractice claims in the United States. That's the key. Those are the two key numbers that really help make the point. So if we were going to use this in a campaign to address malpractice, before I do that. So one other thing about facts and data, it's helpful to use social math. This is a wonderful concept. It's a method used to make complex data relatable and understandable by comparing them to familiar items, especially items that are familiar to the people you're talking to. So let's say we're talking about tobacco control and we're talking about smoking and health. And I tell you, there are 201,500 smokers in the Chicago area. That's a lot, right? But what can we put that in context? What does that mean? Especially if I'm talking to just someone on the street, they might just shrug and say, okay, well, that's a lot of people. But if I try and put it in context, I might say that's enough to fill 5 Wrigley fields, right? Because Wrigley seats about 41,000 people. That gives you a sense of how many people we're talking about. 201,000, 5 Wrigley fields. People in Chicago, I assume, have gone to Wrigley Field and know how big it is. And that's something that can also people visualize, right? So that's why you might see when people are talking about amounts of water, they might talk about enough water to fill X number of Olympic swimming pools, right? Or if you're talking about geographic areas, that's the size of Rhode Island and Delaware combined. It's those kinds of comparisons that make it easy for people to understand the magnitude of the numbers and the data that you're giving them, right? And of course, there's Wrigley Field. All right, so using social math, like if we put all of this together step by step, there are four steps to take to use your numbers effectively. So first, you introduce the point you are about to make with your data. And this is important because you are framing it. If you just dive in and start providing numbers and information, people will interpret those numbers based on their beliefs and understandings and what they think. And they might not take from that data what you want them to take from the data. So you start by introducing it and framing it. And then the second step is you want to introduce one or two key numbers that support your point. Again, you don't want to overload people with numbers. What are the one or two key numbers? And those are the ones that they'll really remember. And you can always provide links to more extensive data. Then you want to create those comparisons that are relatable, use the social math. And then you want to end with a hopeful solution. So if we were going to put this into practice with the malpractice example, we might start by saying most doctors are highly skilled and competent. In fact, just 2% of the nation's doctors are responsible for 39% of the malpractice claims. There's your important number. But we want to even be more helpful and put it in context. So we say that's equivalent to just 2 students out of a class of 100, right? That gives people a sense, wow, it's just a small number. So then we offer our solution. If we offer more effective rehabilitation and education for doctors, we can dramatically reduce unnecessary harm to patients. There you have your step-by-step in using social math. All right. So my pitch to you is that really, I think all public health practitioners are communicators, right? And these tools are tools that I think will be vital for public health students to learn. It's possible to, and I would encourage you to integrate them into your existing courses, right? For instance, if you have a biostatistics course, you can talk about why facts alone aren't persuasive and how to use numbers effectively, how to tell a story with numbers. If you have an epidemiology course, you can talk about how to get ahead of disinformation, message framing around vaccines as well, right? And with health systems or law classes, you can have, this is a great possibility for case studies where you can look at communications campaigns that have been effective and reverse engineer them and figure out what motivated lawmakers to act and what more, like how did that effort work? I am going to allow time for questions. I want to just say that all of these concepts and more are in a book that my colleague Ann Seawright, who runs the Center for Public Interest Communications here, and I just published in the spring. It's kind of one of the first textbooks on public interest communications, and there's a QR code, and again, there are more resources that I'll provide for you. It is a Routledge book, so if you have access through your system, your live university system, free access, you can get it for free digitally. It has all of these concepts. We also have a Public Interest Communications Summer Institute. So I launched something called the Public Interest Communications Educators Network, and it's a network of about 250 academics from around the country in a variety of disciplines who are interested in learning more and sharing public interest communications concepts with their students. This will be our 5th Summer Institute, and it will be at Arizona State University. The theme this year is Belonging in Action, and it's about communications for a divided world and how we can find that common ground to make progress on our issues. We have a lot of resources here on our center website, the Center for Public Interest Communications, and you can find theories and frameworks and research and case studies on the center website. And then our Educators Network, you are welcome to join that as well. It's a listserv. It's not going to overload your email. We have about 200 plus more members. Feel free just to let me know if you'd like to be added to that. All right. So here is a QR code where you can get more resources, and it's a Google Drive with a lot more information.